Good morning, everybody. I'm here with Dr. McAnulty and also John Brogden to talk about mental health issues from Lifeline. So to 8 p.m. last night, there were 131,174 tests, and from those tests, there were 1,533 locally acquired cases of COVID-19. There are now close to 11,000 people with COVID-19 who are currently being cared for by New South Wales Health. The vast majority, about 90%, are being cared for at home, in the community, or in New South Wales Health's special health accommodation. There are currently 1,041 COVID-19 cases that are being managed in our hospitals, and there are 173 people in intensive care, and 62 of those people in intensive care are requiring ventilation. I want to stress the importance of vaccination yet again. When we look at the number of people in our intensive care units, of the 173 people in ICU, or intensive care units, 137 are not vaccinated. 29 people have received just their first dose of a COVID-19 vaccine, and 7 have received 2 doses of a COVID-19 vaccine. Very sadly, to 8 p.m. last night, we have had 4 more people pass away. We had a gentleman in his 60s who died at his home, and he was from Western Sydney. We had a lady in her 80s from southwest Sydney. She died at Fairfield Hospital. We had a gentleman in his 50s from Western Sydney who died at Westmead Hospital, and a gentleman in his 70s from southwest Sydney who died at Liverpool Hospital. I just want to express my condolences to each of those people's families and friends. The passing of a family member or a friend is always extremely sad, and I just want to really express those strong wishes to each of the community members who knew those people, and to just say we're thinking of you. Sadly, none of the 4 people who passed away were vaccinated. The good news, though, is New South Wales residents are still getting out there and getting vaccinated at a great rate of speed. There were almost 130,000 vaccines yesterday administered in New South Wales. Almost 50,000 of those were administered by the New South Wales Health team, and the balance of the other cases were administered in pharmacies and general practices. I stress there are a range of avenues for you to get vaccines right across New South Wales. There are pharmacists and there are GPs with vaccines, and of course there are also the state established hubs and centres, and there should be one near you. Book in and get a vaccine. If you are not vaccinated, book in and get one. 72% of people aged over 16 now have received 1 dose in New South Wales, and just shy of 40% are fully vaccinated. So 39% are fully vaccinated. I want to thank the community more broadly across New South Wales for getting out and being part of what is a great journey to beat this virus, to get vaccinated. It's the way forward. Tomorrow we're going to have a Super Sunday vaccination blitz for all police, fire and emergency services personnel who live in those 12 LGAs of concern. We're obviously very, very concerned as a government and as New South Wales Health to make sure that we have all of our frontline workers vaccinated. And so tomorrow is a very special day, and I would just say to those remaining, many of the emergency workers have already been vaccinated, but if you haven't been, tomorrow is your golden opportunity to go and get vaccinated. and you can go through nsw.gov.au, and there's also links that have been sent to many of those workers from their employers. I want to stress also that healthcare, hospital and aged care workers from these 12 LGAs of concern can also book in. So I stress healthcare, hospital and aged care workers can also book in for that Super Sunday tomorrow. The participating vaccination hubs for those workers are at Sydney Olympic Park, at Bankstown, at Macquarie Fields and Prairie Wood. And as I said, you can go through nsw.gov.au or the link that has been provided by your workplace. Now, obviously, and I'll ask Dr. McAnulty to give more detail on this in a moment, obviously, and unfortunately and sadly, the majority of our positive cases still continue to be in southwest and western Sydney. As I said, he'll give the details of the numbers and the suburbs. But we all are still having cases across our regional areas, particularly across the far west of New South Wales and across western New South Wales. Through the western New South Wales local health district is much closer to Sydney. Far west is obviously Broken Hill and the area more towards Broken Hill. In the western New South Wales local health district, there were 38 new cases of COVID-19 reported to 8 p.m. last night. Unfortunately, that does bring the total cases in that local health district, that western New South Wales local health district, to 759. The 38 cases that I just referred to, the majority are in Dubbo, 22 cases. 9 were in Burke, 3 were in Bathurst, 3 were in Orange, and 1 in Bogan. To 8 p.m. last night in far western local health district, there were 9 new cases. All of those 9 cases are in Wilcannia. This means that to this point we have a total in that far western local health district of 107 cases. I think there are 97 in Wilcannia and 9 in Broken Hill. And I think there's also one case that I referred to earlier in the week that's now in Queensland. There are 15 new cases across the Hunter New England local health district to 8 p.m. last night. And that brings the total in that district, the Hunter New England district, to 218 since the 5th of August. 10 of the new cases are in the Port Stephens local government area. 1 is in the Lake Macquarie local government area, 1 is in the Newcastle local government area, and 3 are in the Maitland local government area. There are 17 new cases reported to 8 p.m. last night in the Illawarra, and that brings their local health district to a total of 140 cases. Those 17 cases, there were 12 that were actually in the Wollongong area. There were 3 in the Shell Harbour local government area and 2 in Shoalhaven. There were also, in the Central Coast area, there were 15 new cases, and that takes the total number in that district to 93. I want to stress that the way forward, and it's a very positive way forward, is to get vaccinated. I want to thank all of the citizens in New South Wales who have gone out and done what you need to do for yourself, for your family, for your friends, for New South Wales and indeed Australia, and got vaccinated. And I want to say to those who are still hesitating, there is no reason to hesitate. There are very good vaccines available here in New South Wales. There are an abundance of venues where you can get vaccinated, and it is absolutely crucial that for us to get back our freedoms as quickly as possible, for us to be able to get back to our normal way of life, or as close as possible in a COVID environment, you need to get vaccinated. So please do that. Please take up the opportunities that have been offered in so many places. Now I'm going to ask Dr. McAnulty to add some more to what I've already said. And then I'm going to ask John Brogden from Lifeline. We do know that this period of lockdown, this period of COVID, has brought additional stresses on us all. There's no one I know that has escaped that stress. And some of us respond in different ways to that stress. Lifeline can offer you assistance, and John will actually talk about some of those stresses and the assistance that can be offered. So first of all, Dr. McAnulty.
Thanks very much, Minister, and good morning, everyone. There were 1,533 locally acquired cases reported to 8 o'clock last night in New South Wales, and one overseas acquired case for the same period. And there were 131 tests, 131,174 tests reported to 8 o'clock last night, compared to the previous day of over 150,000. Sadly, as the Minister mentioned, there's been 4 deaths reported in that same period, and our sympathies and condolences go out to the families and friends of those people who died. We have had a number of areas of concern identified through both where our highest numbers of cases are occurring and also through positive sewage detections based on our ongoing sewage surveillance system for virus fragments. So we've seen fragments of the virus that causes COVID in several communities where we don't have known cases. And so we're really stressing that it's so important for people living in those communities to come forward for testing with even the mildest of symptoms. So those communities where we've detected fragments of the virus include Tamworth, Glen Innes and Port Stephens in the Hunter, New England area, Cooma in southern New South Wales, and Kempsey on the mid-north coast. So if you live in one of those communities, please be very aware to watch out for symptoms and get tested at even the mildest of symptoms. We've got a number of the highest rates of disease, the highest numbers of disease in the Sydney metropolitan area continue to be in the west and southwest of Sydney, where we've seen over 80% of cases occurring in those areas. So we're particularly concerned about the suburbs of Guildford, Auburn, Merrylands, Greenacre, Liverpool, Punchbowl, Bankstown and the surrounding areas. It's notable that of all our cases, almost 70% are aged under 40 years of age. So this disease is largely affecting younger people. Younger people are particularly concerned because they both are exposed to their kids and expose their kids, but also their parents and older relatives who are quite vulnerable to disease. So it's really important that if you're particularly in younger age groups, please come forward for testing at one of the many convenient sites. Thank you very much.
Thank you, Brad and Jeremy. Thanks for the opportunity to speak today on behalf of Lifeline, and particularly about what's happening with respect to mental health for so many people in New South Wales and Australia. The first thing I want to say is in recent weeks we've heard a lot of people talk about a shadow pandemic in mental health. I think it's important to realise it's not in the shadows, it's real, and it is a crisis. The crisis is extending to all parts of Australia, all parts of New South Wales, and to many, many people. What we have seen is a significant increase amongst children and adolescents in their mental health illness, in their suicidality, and in stress and depression and anxiety. That is a matter of enormous concern. However, at the same time, we at Lifeline are very pleased that people are reaching out in the sort of numbers we've never seen before. Year on year, there's been an 11% increase to calls to Lifeline in New South Wales, and compared to 2 years ago, there's been a 28% increase in calls to Lifeline. There is some silver lining in the cloud, and that is people are reaching out. Last year in New South Wales, there was a 5% reduction in suicide, and bear in mind, 9 months of that year were in the first COVID lockdown. In this year, we've seen no increase in suicides on average across all age groups. So there's good news that people are reaching out and getting the help that they need. I have depression, I have suicidal ideation, I know what it's like to live with mental illness, and I know what it's like to live in mental illness during COVID. It's tough, and people are doing it tough. But there is hope. We are coming, we all hope, towards the end of the lockdown. And one of the best things we can do for people's mental health is get out of lockdown as quickly as possible. In the meantime, there are a number of things people can do to look after themselves. It's really important to keep a routine. Don't stay in bed all day. That won't help you at all. Get up, get changed. It's really critical also that you take advantage of the opportunity to exercise. I sometimes think when we hear the word exercise, people think they've got to do 100 push-ups. I don't think that's what we mean. What we mean is just get out and go for a walk. Walk around the block twice, go down to the park and come back. Just get some sun on your face, some wind on your face, maybe even some rain on your face. But please get out. I can't stress enough how important it is to get out of home and use the opportunity for exercise, to get out and to get some fresh air. That's really important as well. I know this is hard, but try not to catastrophise things because we are getting through this. Gladys Berejiklian's made it very clear, as has Brad Hazzard, things will get worse before they'll get better, but they will get better. So we are coming through the other side of this. We need to hang on to the opportunity to see our way through this, and we need to hang on to the hope that we will get there. I know it's hard. It's incredibly difficult. No child, no adolescent has ever lived through a time like this. In fact, most of us have never lived through a time like this. And this is affecting everybody. This is affecting us all in very different ways. So please look after yourself. Please be kind to yourself. And the other important message is don't suffer in silence. Don't think that nobody cares, and don't think you can't reach out for help. Whether it's Lifeline, 24 hours a day, 7 days a week, on 13, 11, 14, we're there to help. And although our calls have gone up, we are answering our calls. I also want to say we have a text service, 0477 13 11 14, that's operating 14 hours a day on its way to 24 hours. And particularly for young people, Kids Helpline is there, 1800 55 1800. So please don't suffer in silence. People care, people want to help you. It's okay not to be okay right now. These are extraordinary times, but there is help there. Please reach out and get it, because it can be the difference for you between life and death. Thanks very much, John.
Minister, a couple of questions on hospitals, if that's okay.
Sure.
Preston's Lodge Aged Care Home has 8 COVID positive patients.
Sorry, just that again.
Preston's Lodge Aged Care Home has 8 COVID positive patients. They are reporting that South West Sydney Area Health has told them not to take those people to hospital because of a bed shortage. Is that happening? Is that a directive that's gone to all nursing homes and aged care facilities?
No, in New South Wales, right from the word go, when there have been cases in aged care facilities, the infectious diseases specialists manage the cases, and they determine whether it's appropriate or not for people to be moved out of effectively their home. And if the aged care facility, for example, has capacity to cohort the group that are infectious and they are not requiring any particular hospital inputs, then just like the majority of people in the broader community, they stay in their home and are managed through that environment. That's not unusual. At the moment, there's about 11,000 people, I think I said this earlier, being managed with COVID across our entire state, and about 10,000 of those are actually being managed in their own home. Let's not forget that about 80% of people who get COVID will have either no or minimal symptoms, and there is no reason in that situation necessarily to have them in hospital. And can I also sorry. One of the other factors too is that, and I'm not commenting specifically on that particular aged care facility, Lizzie, but if you are in an aged care facility, you might also, in addition to the fact that you're home, you may have some other reasons that not to be moved. For example, a lot of older people are easily disorientated if they're taken out of their homes. So those issues are made on an individual basis. Sorry.
Of that 90% receiving treatment at home, how many are getting, I guess, a higher level of care, like hospital-grade in-home care, for example, oxygen or I mean, what extent of them are getting higher levels of care that potentially should be in hospital? And is the government trying to minimise some of those hospitalisation figures by discounting those people receiving hospital-grade care at home?
I did see a report, someone told me there was something in one of the media today about that, but no, that's not correct. Look, these are clinical decisions. It's managed by the clinicians. The government certainly doesn't have an input to determining who is in hospital and who isn't. So the clinicians determine who should be at home and who should be in hospital. Generally, though, the situation would be, answering specifically about oxygen, generally people would not be at home if they had oxygen requirements, but it's possible. It depends on the entire case and the analysis. But why don't I ask Dr. McAnulty to add to that? Dr. McAnulty.
Thanks, Minister. Yes, clinicians work with the patients to identify what the best level of care is, and if people need to be put in hospital for additional care, they are put in hospital. But people, as you can imagine, people with COVID infections can have a range of symptoms, from no symptoms at all to very mild cold-like symptoms to more serious disease, including pneumonia and other complications. So clinicians regularly review patients with COVID, determine where they're best suited, and if you don't need to be in hospital for your clinical care or other reasons, then you're often better off at home. So it's entirely up to the clinicians.
Given a number of patients who have been treated at home have died at home, there has been one today, I don't know the circumstances surrounding that, if you could perhaps provide some details, but given that that has been happening, is care being compromised even at this stage before we head into, a bad October that we're being told to prepare for?
My understanding of the unfortunate death reported in somebody who died at home yesterday was that they had not been tested for COVID until after they had died, and so they hadn't been in the care at present of New South Wales Health. And again, our condolences go to the family of that patient. I've forgotten your question, sorry.
Is care being compromised by that at-home treatment of people not getting to hospital in time?
No, it's in the reverse, in fact. It's clinicians are very keen to make sure that the best level of care is provided to individual patients, and often that will be being at home in your familiar environment, outside, often hospitals where a bunch of other stuff is going on, and it's not in your best interest to be in hospital if you don't need to be in hospital. So it's always a decision based on the clinicians and what's best for the patient.
Can you give a clearer picture then of the hospitalisation rate? Because I know the Premier was saying this week it was about 5%. The latest surveillance report has it at about 12%, and there's been some reports today about 15%. So does that take into account all people being treated at home? Or are you able to give a clearer picture?
So we calculate hospitalisation rates can be calculated on different ways, but it's based on people admitted to hospital, so in a hospital itself. And look, we keep those numbers are very important, and we have been tracking both the number of notifications of COVID throughout the pandemic, but importantly, it's also important to track the number of people admitted to hospital and into intensive care or ventilation, because that provides us as information about just how serious this disease can be for a range of people. And as we've seen in the figures on a daily basis, a range of people across the community are being infected in terms of age, gender, and so it's important that people realise, particularly if young people may think they're invulnerable to COVID, they're not. We're seeing people in their 20s and 30s in intensive care requiring ventilation from time to time. It's a serious disease, and that's why immunisation is just so important, that we prevent this through all spectrums of the community. Immunisation not only protects yourself from getting those nasty complications and requiring hospitalisation and even death, but also protects the people around you.
Is that hospitalisation rate accurate if there are people at home who are being treated at a hospital level?
So the people, where people with any disease, people can be cared for at home because they don't need to go into hospital. If you think of the range of infectious disease that we all get, we very rarely need to go into hospital. So the rate of hospitalisation is one marker that we use to determine the severity of disease. But we're well aware that there's a whole spectrum of disease that people can have out there. But those key points are how many people have the disease, how many people don't need to go into hospital, how many people do need to go into hospital, how many people require intensive care or ventilation, and sadly how many people die. So we look at that whole spectrum of measures.
Tomorrow you're targeting emergency service workers for...
Sorry, 2-6.
Tomorrow you're targeting emergency service workers for vaccination, particularly police. Yeah, so they've been eligible for quite some time. They are people who are dealing not only directly with COVID patients but also with the public on a daily basis. Why haven't they all been vaccinated earlier? And is there any suggestion that that's going to be made mandatory for them like it is for healthcare workers? And if not, why not?
Well, healthcare workers, as you've already observed, we have made that compulsory. And there was some arguments from some against that. My view was that, and the government's view therefore was that health workers did need to provide the safest possible circumstances for patients, and there was no room for people to not be vaccinated. So, but some have obviously not yet, as I think police were one of the first groups to be offered it in the 1A group that the federal government designated. But I know I was just talking to someone about an hour ago who was pregnant and didn't get vaccinated but is now wanting to be vaccinated. There are a whole range of reasons why people may not have been vaccinated to this date. This particular person I was talking to was just indicating she can't go tomorrow because she's looking after other children, but she'll try to go next week. So there's a whole range of reasons. I don't think there's anything particularly intrinsic as a challenge to that, but it's a day when we've said, well, let's have a focus and let's get you all in. There may be, I've got to say, there may be a small group who have to date been hesitant, but I'm hoping that that hesitancy will disappear tomorrow.
It's not mandatory for police at this stage. Will it ever be?
Look, health workers are obviously directly within the health ministry, that is me as minister's purview, and I made that decision. But normal workplace environments at this place would be usually left to their employer, so I would imagine that the police will make those decisions in due course. That is the commissioner would make.
If these people have had the eligibility for the vaccine, they were first on the list. If they haven't had their shot by now, they clearly don't want to. So is this Blitz going to
I think
do
that's
anything?
a big assumption, Lizzie, and I don't agree with that. I think there are a whole variety of reasons. People could have been ill, they could have been, as I said, pregnant, there could have been a whole host of reasons. I think it's a positive opportunity, and I don't think it pays to be negative about that opportunity. I don't think that helps.
They have had months they have had months to be vaccinated, whether they had, babysitting duties one day or anything else. But could this push have something to do with your plan to try and surge the health workforce in that area with, ambulance, firefighters driving ambulance and police driving ambulances? Is that part of that vaccination push?
Look, you're mixing up two things there, but the surge you're talking about specifically is an ambulance surge that you're addressing, and that I did speak to the Commissioner this morning about that. He had indicated that they were doing some work on that. That's not something the government was directly involved in. That was the ambulance service. And what he has advised me is that they have, as you'd expect, been doing the preparatory work for this particular event. That is an increase in numbers. And so he has, once a week I think, he sends out an email to all of his staff, brings them all up to date on what he's thinking about what the issues are. Pretty normal event. And he indicated that if there is going to be, and obviously we think there will be, an increase in patient numbers over the next few weeks, then what he suggested is that they may call in some other emergency staff to help drive ambulances if they need it. I don't think that's been finalised yet, but that's certainly a plan that he has, and I support that plan.
Minister, there are reports this morning that cases...
Can I also just say, while you're asking about ambulance, can I say he did also, while I was chatting to him, tell me that yesterday was the second busiest day for ambulance that they've had in the state's history. And I would just say to everybody, if you are sick, of course, and you need emergency assistance, then of course you should dial 000. But we had the Commissioner for Ambulance here last week or the week before, and he was highlighting cases where people were using ambulances to get band-aids and other things. I mean, really, there's got to be a stress here, or an understanding that we are in the middle of a pandemic. There is no room for people to make calls that are not emergencies. In other words, I put it in the positive. You must call an ambulance only when it's an emergency. So please don't take away an ambulance from somebody else who might need an ambulance, if you know that your particular case is not an emergency. Now, there'll be cases where, for example, if you've got chest pain, well, that's an emergency. But if you want to just get to the hospital to do a visit, well, that's not an emergency. And if you need a Band-Aid, that's not an emergency. If you need some antibiotics, that's probably not an emergency. So perhaps talk to your GP rather than actually rush to the use of ambulances when we're in the middle of a 1 in 100-year pandemic. Sorry.
There are reports that COVID cases have been self-isolating for 14 days. They've completed their self-isolation, awaiting another week before someone actually reaches out to them and clears them. Why is this happening, and is it going to continue to happen as more cases?
Yeah, look, I saw the report in the paper this morning of a young fellow that was in that situation. I did speak to the Chief Executive of the Western Sydney Local Health District. In fact, I also spoke to the local MP who had raised the issue. And I don't know the full detail of that case yet, but I think it's fair to say there's been a lot of pressure on the, about 10,000 cases who are being managed at home. And so the Health Ministry is working with the Western Sydney Local Health District and the South Western Local Health District to try and put in place some new partnerships, and I know with the private sector, and they're moving to try and ensure that people are not missing out on those phone calls to discuss when you can obviously leave your self-isolation. Having said that, I was advised by Health that that particular case that was highlighted in the media this morning, there had been 6 phone calls to that young person's home. But I do think that it's a sign of the stressed health system that we're currently in. The world is in massive stress, the entire world. But the New South Wales health system is still doing far better than almost anywhere else in the world when we have a rising number of cases. So I would encourage people to be patient, and as was said earlier today by senior medical people, if you are having some difficulties in the sense that you think you should have been out of self-isolation, if there isn't been a contact, call your GP and ask your GP to give the necessary advice on how to deal with it. But I'm confident that the work that's going on at the moment and partnering with new private sector organisations who will be working with New South Wales Health to manage those patients at home will make sure that there's far less of those issues in future. But can I guarantee there won't be any of those cases in future? No, I can't. I don't think that's possible when you're in a pandemic, but certainly the health system is doing all it can to manage people in a safe way.
Minister, just back on the hospitalisation.
Okay. She's asked a question yet. Yeah.
Minister,
yes,
we're heading towards a peak in hospitalisations in October.
Yep.
If intensive care units reach capacity, will you consider using other hospital wards as extensions of the ICU?
That was actually mentioned yesterday by the Premier, and again, the government listens to clinicians, and the clinicians are the ones who establish these arrangements and plans. They understand what is happening, and the Premier has indicated we'll talk in more detail on Monday about that. And in fact, I think we'll have at least one, maybe more, clinicians from intensive care who've been part of developing the program. But the point I think that she was making yesterday was that, for example, if there was one particular hospital that had all of their ICU beds being used, then first of all there would be arrangements where the patients would be transferred to, or could be transferred, if it's a clinician decision, but to transfer them to another hospital. We're a network system, and so that's not a huge issue. But also there's capacity to, for example, as patients step down from the more intensive nature of their presentation to the ICU, to the intensive care unit, they might be in, for example, a high dependency unit that's right next door, so still being managed by the intensive care specialists, but as part of just a slight physical move within the hospital. So it's not unusual again, and I think that you're probably better off waiting for the experts on Monday. That is the intensive care specialists who will share with us all and the community, as the Premier said. These are issues we want the community to understand going over the next few weeks, the various stresses and the various pressures that our health staff are working under, and understand that they've got good plans and will be kept safe. But yeah, that'll happen on Monday.
Minister, just back
on sorry, yeah. Sorry, no, that was next. I'll come to you, Lizzie.
Just back on the hospitalisation rates, why was it reported to National Cabinet that the real rate is actually around 15 to 16% when the Premier was saying it's only 5%? Is that misleading to
the residents of New South Wales?
Look, I can't comment on that. You'll have to leave that till the Premier's back. I don't sit in National Cabinet, but statistics can vary, and it could have been a different set of criteria that the National Cabinet was looking for. I simply don't know the answer to that. Yeah, Lizzie.
Minister, given the bed shortage that's looming or already here in New South Wales hospitals, are non-COVID patients being pressured or asked to leave hospital? We've spoken to a family of an elderly gentleman. He's only got days to live. He's been asked, could he please discharge or leave hospital to make room?
I can't comment on that specific case, but what I can say is that hospitals are obviously there to look after people who need clinical care, and the clinicians make those decisions on who needs clinical care. And that's always been the case. It doesn't matter whether you're in a pandemic or otherwise. I mean, I've heard those sorts of comments been made, not in that COVID sense, in the past, long before COVID, when I was Health Minister for the previous few years. And I think sometimes there can be miscommunication. It may have been the clinicians have determined that, for example, the person might be more comfortable at home. There could be a whole range of reasons for that. I can't comment on the specifics.
Are you satisfied that all authorised workers from the LGAs of concern have been able to get their first dose by Monday? And should those that have made an appointment and can show evidence of that appointment be able to still continue work?
Look, the decision was taken some time ago that the authorised workers from the 12 LGAs had until Monday to have their first dose of vaccine. Those people are obviously vital for us, and we understand the essential aspects of their work for the community. But we also understand the essential aspects of being vaccinated to keep people safe. So the decision was taken that they had until Monday, and if they are not vaccinated by Monday, then obviously they can't go out to work legally, and they shouldn't, because they'll be putting people at risk. Look, I'll have discussions on Monday. We'll review the circumstances, but my strong message to all of those folks is if you haven't already done it and there's been ample time, please go and get vaccinated, because it'll save you, it'll save your family, it'll save the community, and it'll save New South Wales and Australia from this ongoing terrible virus.
Can I ask a question of Mr Brogden, if that's
Sure,
all right?
yeah, absolutely.
Thank you. Mr Brogden, on September 13, vaccinated people will be able to congregate outdoors with 5 other people. Do you expect that to make a difference in terms of people who might be struggling in lockdown? And do you hope to see more freedoms for vaccinated people to help ease that mental load?
Yeah, there's no doubt that every little bit helps, and whether it's just getting out with 5 people, which is different to the situation now, that will make a massive difference. We yearn for 2 things as human beings. We yearn for certainty and for human contact. At the moment, certainty is very difficult to deliver, and human contact is very restricted. So the more human contact we have, the more capacity to catch up with friends and family will make a massive difference. And I think it'll give people hope that there is a way out, and we're on that way out.
Do you hope to see more of those freedoms extended to vaccinated people, you know, as vaccination rates go up?
Look, I can't speak to how the detail would happen, but it's very clear that the governments have set 70 and 80% targets. People are very focused on that, and I think clearly we're on the way to that. And people can feel the hope and the enthusiasm that we're getting to those numbers soon, and they'll be able to have more freedom. There's no doubt that the quicker we get out of lockdown, the better it is for people's mental health.
Mr Bromley, can you talk us through what happens when someone does call Lifeline? What's the process? How long does the volunteer spend on the phone with them, and do you have enough volunteers given so many calls?
Yeah, look, we've got an extraordinary volunteer base, 4,500 people around the country who volunteer to answer our calls. I always say it's not like we're asking them to volunteer to do their kids' barbecue down at the soccer match. We're asking them to sit on the phone for 4 hours in a shift and deal with people in extraordinary crisis, and about 30% of them are at high risk of suicide. So what we've noticed with our calls is the sorts of reasons for people calling haven't really changed. If anything, they've accentuated. So we've always had a lot of people call who are lonely. They're lonelier. The other thing we've noticed is that people are on the calls longer than they've been before. So that demonstrates a higher level of distress and concern. Our objective, a bit, Brad, like an ambulance or a paramedic, is to get them through that incredibly difficult period and match them up with the services they need. We're now averaging over 1,000 calls a day in New South Wales. 2 years ago, that was 28% less. That was around 700 and something calls. So we're now seeing a very significant load of calls coming into us. The good news is that we have these extraordinary life-saving volunteers who just keep putting in more hours. We always do want more volunteers, and people can volunteer to work with Lifeline on lifeline.org.au.
Minister, just on the Moderna, it's been given provisional approval this morning. Do we know when we might see teenagers getting the Moderna shot in New South Wales?
Look, the Moderna approval from the TGA has only just come through, and we haven't been advised of the details of when we will see Moderna, but obviously very keen to get vaccine in the arms of young people. We know that young people transmit it. They don't tend to have major symptoms at all, occasionally, but not often. What we do know, though, is they can actually be spreaders of the virus, so we're very keen to do that. We welcome, as Health Minister of New South Wales, I absolutely welcome that news and look forward to getting more details on how we can actually get the vaccines into arms.
Minister, we're still seeing the virus spreading from Sydney up into Hunter, Newcastle area. Whether it's the tree lobbers, we're just seeing more cases spring up in that area. What is the government doing?
Not necessarily from that situation. It can be from other cases already there. But yeah.
Of course. But what is the government doing to make sure that cases aren't spreading from Sydney into Hunter, New England area?
Well, there's already a number of measures that are in place, including having to get permits, and I think the measures that are there at the moment are a sensible balance. But again, the fact is that the virus can get there through a number of means, and of course a lot of the spread that has actually occurred has been through people leaving Sydney illegally, and that's been a huge issue for us. So I would just say again to people, everybody in Sydney, you shouldn't be travelling outside Sydney except for the designated reasons. And if you require a permit, make sure you get one, because the police are on the roads and they're certainly enforcing it. But more fundamentally, you owe it to the rest of our community to not spread the virus. It just shouldn't happen.
Yes, sorry. As we reach those higher rates of vaccination, are you concerned that they will plateau? Like
I missed the first part, I'm sorry.
As we do reach those higher rates of vaccination, yes, are you concerned that they will start to plateau like we have seen in other parts of the world?
Look, I think it's probably fair to say that when you get to up to about 90% or so, you could expect that there might be some more challenges to get some of the remaining community vaccinated. But my message to those people would be, this is a 1 in 100-year pandemic. Let's not forget the danger that you have to yourself and to your family if you don't get vaccinated. What we've seen in Europe, what we've seen in the States, is that this becomes a pandemic of the unvaccinated, and they will miss the freedoms, they will miss the opportunities that the rest of us will have. I can't imagine that private enterprise, so somebody in a theatre, for example, will want somebody to come into their theatre if they haven't been doubly vaccinated. It's just not going to happen. So I think the time has come for people to get real. If they've got any hesitancy, drop it in the basket and get out and put your arm out and get a vaccine.
Included Randwick in that list of eligible suburbs for the vaccine blitz. How close is Randwick to being added to the LGAs of concern? Should people there...
I saw some reports of that during the week, and I raised that with Dr. Chant, and I don't believe that it's close at all at the present time. Sorry.
The Mayor said he met with
I'm sorry, who? What?
The Burwood Mayor said he met with you and other officials about the fact that it's still an LGA of concern. Yet it's only had 36 cases in the past 4 weeks, whereas next door at Inner West it's had 222. What is the criteria for somewhere like Burwood to get out of being one of those LGAs of concern?
Look, can I just stress again that the government doesn't make decisions in a vacuum. Dr. Chant was actually on that call. We were all on that call. There were 3 ministers, there were health officials for an hour and 3/4. And the Burwood Mayor had it fully explained to him by Dr. Chant. Dr. Chant and her team make those recommendations, and her concerns remain at the present time that over a number of days, averaged out over a couple of weeks, there are sufficient cases that she doesn't believe Burwood should come out of that being an LGA of concern. And I think we've got to accept that Dr. Chant and her public health team are doing an extremely good job, and they'll make those decisions, not politicians.
Why is it Inner West then an
Sorry?
LGA? Why isn't the Inner West Council next door an LGA of concern?
Can I say again, do you want to say anything on that, Jeff? all right. Well, I'll just say this. It was all explained yesterday. Perhaps ask Dr. Chant the next time she's here because she can go through all the epidemiological aspects. I don't think that I can really give that today, but they were all given an hour and 3/4, and Dr. Chant spent a lot of that time making the explanations, and the explanations are well-based epidemiological public health decisions. But can I say this? I would say that if we can get any LGAs out of being the 12 LGAs of concern, certainly the government would like to do that as soon as we can, but we're not going to be doing it when our health officials are telling us that at this stage that's not the wisest course for the community. Sorry.
Would the government consider easing any more outdoor restrictions, say people being able to travel within 10 kilometres or large groups of people being able to gather outside ahead of the 70% double dose, for those mental
We're
health
constantly asking Dr. Chant and her public health team, the entire public health team, whether or not there's any more opportunities to give people back more steps in a more normal way of life. And we'll have to wait for her advice on that. But at this stage, obviously, whilst we're enthusiastic and keen to see more freedoms back, we do have to rely on the health advice. And at the moment, it's not the perfect time perhaps to be expecting too many changes because we are today at another high, very high level of cases. And the majority of those cases, something like 80 to 90%, are occurring in that area of southwest and western Sydney still. So, but hopefully in the near future we'll be able to get some more positive advice from Dr. Chant and head down that path. And can I just say to all the people in southwest and western Sydney, I know it's a struggle and I know it's difficult, but thank you for actually sticking with us on this, and hopefully in the next few weeks we'll see some changes. But please, if you haven't been vaccinated, get out and get vaccinated, because we do know that vaccinations are the way out of this current situation. Can I also just thank all of the health staff, all of the staff who work in our hospitals, whether it's the cleaners who keep the area free of infection, whether it's the administrative staff that are there saying hello to patients as they walk through the door, whether it's the emergency staff, whether it's the staff in the wards, the nurses, the doctors. Thank you. You're all working under enormous pressure, and I, as your minister, just want to say thank you on behalf of the community for the work you do, but also thank GPs and other medical specialists who are also putting themselves at the front line to keep all of our community safe. Thank you, everybody, for that, and see you at 11 o'clock tomorrow. Thank you. Thanks.